So this is how I see precision medicine in cardiology. I think people are talking about precision medicine, and that has currently just been relevant to the oncology world. And I want to open people's mind to how I feel precision medicine and cardiology can happen. So let me take you back a step and tell you how, as physicians, how doctors think, or how, as physicians, we like to see, or what is the execution cycle. We all get a history, and we do a physical, based on what patients are telling us, if it's accurate, and based on our exam, we have a potential differential diagnosis. Say, okay, this could be this, this, and this. And to tease it out, like, is it a heart problem or a lung problem or a brain problem, or a water issue, which, we order a bunch of tests, and we do diagnostic testing. We use radiological tests, ultrasounds, CAT scans to assist us in that diagnosis, and then we provide treatment. So the way I see the future of medicine, what I call as precision medicine, is that the history part is going to be either assisted or made obsolete by genomics. So there's a lot of companies out there that are doing a lot of hard work in getting very precise genetic data so that we can outperform just a bundle of risk or probabilistics. And once we're able to achieve that with the genomics, I think we'll be a step ahead in becoming precise. On the exam side, there's a lot of new variables. So I'm wearing, for instance, a Fitbit, and there's a lot of biometrics that are being tracked by Silicon Valley companies. People's heart rates, their blood pressures are being tracked. Medical device companies have made Wi-Fi satellite-based devices to make it even easier to collect data. So rather than a 5-minute exam that you get in my office, now we have a 24-hour 24-hour data on how your heart rate's doing, how your blood pressure is doing, what's happening to your physical activity status, and I think that was already a step ahead in making medicine more precise, because rather than acting on a snapshot, we're acting on full video, a 24/7 viewpoint, or a bird's eye view of people's biometrics versus just one snapshot. So I think that would make it more precise. On the testing side, most companies like Philips, Siemens, IBM Watson, all these professional companies out there are getting into artificial intelligence. Softwares are getting stronger with the help of our IT folks from Silicon Valley, where the same data that we had before, for instance, in my world, we had to manually track somebody's calcium score, or manually find out the volume of plaque, or lesion-specific calcium, or the amount of total calcium in their hearts, the amount of thickness on their carotid arteries. All this is becoming automated with the help of artificial intelligence, and now we can just do a quick scan, plug in that data, and then that data can be pitched to an age-matched control, which means to somebody who's about your age and size, and that would make it more precise interpretation of that data versus taking an absolute. So I call it the artisan approach, but not one size fits all, which is truly what precision medicine is about. So I think with the assistance of genomics and genomics company, with the assistance of digital health, mobile health, and wearable technology, and the assistance of advanced artificial intelligence tools in medical imaging, we would be able to make medicine extremely precise, a very precise diagnosis, so then we can really fine-tune and tailor a precise treatment for you. That's what I call the artisan approach. Others call it precision medicine.